Good afternoon, everybody. Let's go ahead and get started. I still see a lot of people hopping on, but let's go ahead and begin. This is the Assistive Technology in Home and Community-Based Services webinar. I'm Marty Exline with AT3 Center, and the AT3 Center is the training and technical assistance provider for all of the 56 state and territory Assistive Technology Act programs. One of the key elements of the American Rescue Plan Act passed this year, of course, is the enhancement of the federal funding for home and community-based waiver services. And of course, assistive technology is one of the key services that can be available through home and community-based waivers. There's also an increased emphasis on assistive technology in states that are involved with their technology first initiatives to make certain that assistive technology solutions are considered as a first option for individuals, regardless of their level of disability or type of disability. So let me first go ahead and introduce today's panelists. Go ahead and go to the next slide.
I'm sorry, Marty, I'm still having technical difficulties here. I apologize, it's not advancing for me. There you go.
Great, thank you. First of all, Damon Terzaghi with Advancing States. Of course, Advancing, he's the Senior Director of Long-Term Services and Supports. Advancing States, of course, is represents the 56 state and territorial agencies and disability agencies on aging and disabilities and long-term services and supports. Damon and Advancing States do a fantastic job with Medicaid and all types of long-term care services and supports issues. Then David Baker is the director of Missouri Assistive Technology. He has many years of experience with not only with the Missouri Assistive Technology Program, which is a state assistive technology program under the AT Act, but also with just a wide variety of assistive technology issues and positions. Britta Huff is the Community Life Engagement Project Manager with the Ohio Department of Developmental Disabilities. And of course, Ohio has certainly been a leader in the technology first movement. And then, as I mentioned, I'm Marty Exline with AT3 Center. And of course, the AT3 Center provides training and technical assistance to all of the 56 Assistive Technology Act states and territories. So can you jump to the next slide? So just a few reminders, this session is being captioned. So if you want to look at the caption, just click on the CC button on the control panel. Please, if you have questions or comments during the session, please enter them into the chat window, and comments will be addressed at the conclusion of the panel. And then also, we will be sending out a post-webinar survey, and we really appreciate that you complete it and submit it back when you receive it. We want to know more about assistive technology related home and community-based service projects in your state or territory or initiatives. And with that, let me go on and just kind of touch on our goals for today. So for the session, we hope that the participants will have an understanding of the purposes and different kinds of services that can be provided through HCBS waivers and more about the waiver process. Be more aware of the types of activities that states have included in their state spending plans for the American Rescue Plan Act. have a better understanding of how technology first initiatives are incorporated into long-term services and supports to allow people with disabilities to experience more independence and personal freedom. And then finally, to be aware of the kinds of activities that state and territory, the Assistive Technology Act programs can participate in to enhance home and community services and long-term care services. And with that, I'm going to turn it over to Damon Terzaghi with Advancing States. Go ahead, Damon.
Fantastic. Thank you so much, Marty, and thank you all for joining us today. I've been looking at the chat box and very happy to see representation from all over the country. So it's just wonderful that you've all taken the time out to join us today. As Marty said, my name is Damon Terzaghi. I'm a senior director here with Advancing States, and we are the national association that represents state government agencies that do aging and disability services. If we want to go to the next slide, please. So we do a lot of work across different programs, including Medicaid, Older Americans Act, and state and other federal programs that deliver services and supports to older adults and people with disabilities. Marty asked me today to do a couple of things. First is to give you all just a basic introduction, and for many of you, maybe reminder of what home and community-based services are in Medicaid, how they're authorized, and some of the parameters and dynamics that maybe impact what you see at the service delivery level for home and community-based services. Then he asked me to transition a little bit to talking about the Rescue Plan Act and the increased funding, how states are using it, and then hand it over to our panelists to talk a little bit more about assistive technology in those funding initiatives. So let's move to the next slide. So Medicaid home and community-based services waivers are really based in the history of the Medicaid program. When Medicaid was created back in 1965, long-term care in our country was very much institutionally based. You're talking about really large institutions, nursing homes, those sorts of things. So when the program was created, it mandated that there was nursing home coverage as part of the benefits package, but there was not a corresponding home and community-based services package at that time. Home and community-based services really developed over the years, especially with a lot of the independent living movement in the 70s, leading up to the creation of the home and community-based 1915C waiver program back in the early 1980s. So when we talk about home and community-based services, we are talking about an optional benefit that states that operate Medicaid programs can choose to deliver, but not necessarily have to deliver. These 1915C waivers that I talked about are the primary way that home and community-based services are delivered. But over the past roughly 10, 15 years or so, there have been some new authorities implemented as well that give different types of flexibility in state Medicaid programs. So if we move to the next slide, I'm going to talk through a little bit about what these authorities are. So you'll see a bunch of references with numbers and letters. Those are all referencing the part of the Social Security Act that creates the statutory authority for these types of Medicaid home and community-based services. So in 1915C waiver, it allows the state to waive or not apply certain core Medicaid requirements, including comparability. Comparability means you deliver all the same services to everyone who's enrolled in Medicaid, creating that comparable service package. You can waive that through 1915C waivers in order to target benefits to specific population groups, such as older adults, individuals with intellectual and developmental disabilities and those sorts of things. One of the key things to remember about 1915C waivers is that they must be cost neutral, which means that when a state applies for them, they have to demonstrate that operating the waiver would cost the same or less than serving those individuals in an institutional setting. You can also cap enrollment and establish waiting lists for a 1915C waiver. In an 1115 demonstration project, these are supposed to be experimental pilot demonstration projects. And again, there's a budget neutrality requirement associated with them. 1115s tend to be more comprehensive than just home and community-based services, but we do see a number of states that authorize their HCBS through these 1115 programs. 1915I, this is a newer one. This is a state option. It does allow you to waive comparability and target to specific populations, but it does not have the cost neutrality requirements or the ability to limit enrollment the way that 1915C and 1115 does. 1915J allows states to provide self-direction in programs that were already existed, but this essentially allows for a little bit more flexibility and participant control over the services. And then 1915K is what we call the community first choice option. Similar to 1915I, it is a state plan benefit. There's no cost neutrality requirements, and there's also no ability for the state to cap enrollment and establish waiting lists. The benefit of 1915K for a state is that it provides 6% increase to FMAP, and what FMAP is the federal share of Medicaid spending. So the federal government will actually pay more for a community first choice service than it would for other types of services and supports in the Medicaid program. When you look at community first choice and compared to the other ones, people might ask, well, why don't states use it more if it does provide that increased funding? It does have a more limited benefits package than 1915I or 1915C may provide. And also there are concerns about the budget ability or the capacity of state budgets to serve all individuals without the opportunity or the option at the state level to establish those limits or those waiting lists. So let's move to the next slide. So as I mentioned, 1915Cs are the most common way of delivering home and community-based services. 48 states have at least one 1915C waiver. And in this world, we talk about 51 states because the District of Columbia is counted as a state in the Medicaid program. So the remaining 3 states that do not have 1915Cs deliver the same sort of services and benefits through an 1115 waiver instead of that 1915 option. For those who might be curious, Arizona, Vermont, and Rhode Island are those 3 states without a 1915C waiver. There are 8 states with a 1915K benefit, and 13 states have adopted a 1915I benefit for those home and community-based services options. You'll see at the bottom of the slide, these numbers are pulled from the Kaiser Family Foundation's just really great report they do on long-term services and supports around the country. So let's go to the next slide. So Marty asked me to go over a little bit about the process for securing a waiver. So states have to apply to the federal government to receive a home and community-based services waiver. The applications, they're very long, usually several hundred pages, and they have to talk about the services that will be included in the waiver, the individuals that will be covered, assure that cost neutrality that I talked about earlier, as well as meet other sorts of assurances, such as protecting the health and welfare of participants. It's a really significant one in the waivers. Once that waiver is developed at the state level and submitted to CMS, CMS reviews and ultimately either approves or denies the waiver. The approval lasts 3 years upon an initial application and then 5 years upon every renewal. The waivers are renewable, but the state does have to come back every few years and essentially demonstrate to CMS that they were doing all the things they said they were doing in the waiver, meeting all of those assurances and those requirements in order for CMS to grant the renewal of that waiver. And the reason states do this, the reason they keep going back to CMS for approval, is because the approval of that waiver essentially releases the federal funding. It allows the state to pull down that federal money that I mentioned earlier, which serves as a match to delivering these services and supports. And then just as a reminder, cost neutrality does not apply to 1915I or 1915K services. There's a lot of different pros and cons to that from a state perspective. One of the things to remember is that for those of you who work in the mental behavioral health services field, you might see that there's not as many 1915C waivers for behavioral health as there are for other types of services. And the reason for that is because there's a long-standing policy that essentially prohibits Medicaid funding to be spent on institutional services and supports for adults between the age of 21 and 64 who reside in what's called an institution for mental disease, an IMD. And because there's no funding for an institutional setting in Medicaid, there's therefore no way to demonstrate cost neutrality for a waiver. So that's kind of why we go over these types of weird nuances within the waivers, because those types of historic policies lead to why you see a lot of waivers for intellectual developmental disabilities, older adults, people with physical disabilities, but not as many on the mental health and behavioral support side of things. However, you do see states starting to use 1915I to deliver those services in a mental health arena, because again, cost neutrality doesn't apply there. So they actually are able to bring up some of these home and community-based services without that limitation that I just talked about. So let's move to the next slide. Hopefully with that framework, it gives you enough of an idea of what these dynamics are at the state level with creating and authorizing these home and community-based services. So let's move to kind of the topic du jour. Under the American Rescue Plan Act earlier this year, Congress provided states with an extra 10% in federal funding for Medicaid home and community-based services. So again, I keep referencing this federal matching, the FMAP. This bumps it up by another 10% above whatever they're getting today. That is a significant amount of money. When you look at the amount that's spent around the country, the Congressional Budget Office, which is responsible for estimating costs of legislation, said it was probably going to cost the federal government about $12 or $13 billion to implement this policy. I think many of us in this field would argue that estimate was low. It is an injection of a significant amount of funding into the HCBS spending arena at the state level. And so what you're seeing is that a lot of this money is being proposed to be pushed out in a variety of different initiatives, including assistive technology expansions, which we'll talk about a little bit later. Now, as a condition of receiving this funding, states may not reduce their state HCBS spending And then they must also keep their eligibility criteria, their services, their payment rates to providers at a level that is at least, if not higher than what was in place as of April 1st, 2021, when this funding became effective. The additional funding that's provided must be spent on efforts to enhance, expand, or strengthen HCBS. So by virtue of getting this additional federal funding, states can't take it and spend it somewhere else. They have to reinvest it into their HCBS system. Let's go to the next slide. As a condition of getting this funding, states had to actually submit spending plans to CMS on how they intend to utilize this funding. So states were required to submit these plans over the summer. There was an initial July deadline, but where states had to get something in. Some states got it in sooner. Most states waited until July to submit their plans. And now they must submit updates every quarter that details what they've done so far and what they plan to do in the future. Those quarterly updates do actually allow states to modify their spending plans and either add new things or maybe make modifications to things that didn't exactly go the way that they had thought they were going to go when the initial plan was submitted. So when you think about these spending plans, it's a really good way to kind of conceptualize what are states most interested in the HCBS world, what do they most want to address or fund or somehow enhance using this funding. CMS did release a website recently that shows you all of the state spending plans state by state. So you can look at all of the 51 spending plans, no territory submitted one, and get a sense of what each state is proposing on an individual basis. And we at our organization also went through and tried to categorize what some of the key areas of spending were in the proposal. So current initiatives, you can kind of get a sense of what states are really interested in doing as a result of this broader look at all of the spending plans in aggregate. So let's move to the next slide. Starting to walk through some of the priorities that we saw across the country. So we did see a lot of states propose new and expanded services such as caregiver supports, home modifications, assistive technology was a big one within those plans. We saw states proposing additional waiver slots. If you recall my reference to allowing a waiting list, when there is a waiting list in place, a state can increase the number of slots to essentially bring people off of the waiting list into the program. So we did see a lot of states propose doing that. Provider rate increases, one-time bonuses, rate studies to essentially take a look at what's currently being paid and what maybe would be a better way of paying for services were all parts of these proposals. If we go to the next slide. Many states really looked at training and certification for providers, giving those entities some support, which we hear over and over again, is really valuable to the provider community, both because it can help them enhance their skill set, do their job better, feel more comfortable with it, but it also opens up opportunities for career advancement to those providers who go through it. A lot of recruitment and retention bonuses. In the home and community-based services world, there's a lot of concern about whether or not there's sufficient workforce to actually meet the demand for HCBS in the communities. So we do see a lot of emphasis placed on ways to recruit and retain workers, telehealth improvements. The next one, LTSS EHRs, that's electronic health records, to try and modernize and get some of the LTSS information into the broader electronic health ecosystem that's been developed over the past 10 to 15 years. health and welfare technology, technology to help states better track, manage, and monitor the health and welfare of participants and then respond to incidents when they do occur, housing supports, and then lastly, behavioral health initiatives. Like I mentioned earlier, behavioral health has really been an area that hasn't been as integrated into HCBS as people would like historically. So with this new funding, with some of the new opportunities that states have to deliver those services, you are seeing more and more states looking at leveraging this funding to address those types of initiatives. So with that, I'm going to move to my final slide. And hopefully this conversation gave you guys a good foundation to kind of understand what's happening around the country with some of the initiatives and efforts that our colleagues will talk about later. So with that, I'm going to turn the presentation back over, and thank you all for your time.
Thank you so much, Damon. Much appreciated. I'm going to go ahead and turn it over to David Baker to talk a little bit about the involvement in Missouri of the AT program and coverage of the assistive technology in Missouri's waivers.
All right. Thank you very much, Marty, and good afternoon, everybody. And Damon, thank you very much. That was very informative. Actually, I scribbled a bunch of notes there as you were talking about things that I was not completely and totally aware of that I feel like I should. So I'm David Baker. I'm Director of Missouri Assistive Technology. And if I understand my charge from Marty correctly, my obligation here today is kind of talk about sort of the intersection of an Assistive Technology Act program and waivers in a state. And in our case, we're talking about Missouri here today. And so the belief that assistive technology is a critical service among the long-term services and supports given to individuals with disabilities in Missouri is very much alive and well. And there's definitely a commitment among key stakeholders, and we're increasingly seeing the positive impacts on the lives of individuals across the state through the ability to access assistive technology and other services through waivers in the state of Missouri. And I actually feel like there's some very exciting things that have happened, and even more exciting things that are going to be coming down the pike here over the next year or so. So overall, in terms of how Missouri assistive technology sort of intersects with waivers in the state of Missouri, I'd refer to it as sort of an a la carte approach. And I will kind of explain that a little later as we go through the slides. But to give a little bit of background here about waivers in the state of Missouri, there are 4 waivers that apply to children and to adults that have assistive technology in them that come through our Department of Mental Health. And so there are our comprehensive waiver, our community support waiver, our Missouri Children with Developmental Disabilities waiver, and then our Partnership for Hope waiver. There's actually another waiver, a head injury waiver, that's in the Department of Social Services that has recently added assistive technology to its menu of options for individuals who have traumatic brain injury. So cumulatively, there's a number of different avenues by which people can access assistive technology through waivers in the state of Missouri. And if my addition is correct, I believe that there are maybe somewhere in the neighborhood of 15,000 individuals receiving waiver services in the state of Missouri. So if we move to the next slide here, we'll talk a little about what some of the key components are in waivers in Missouri that are increasing access to and acquisition of assistive technology. But before we do that, while assistive technology is indicated in waivers in Missouri and defined and a service that's available, as we pretty much all know, environmental accessibility adaptations for the home and then vehicle modifications are also critical to independence, and they kind of are part of the world of assistive technology. So not only do we have assistive technology available through waivers in Missouri, but we also have environmental accessibility adaptations and vehicle modifications. So there's just more than just a straight AT that's available through waivers in the state of Missouri. So if we move to the next slide, the definition in Missouri's waivers on assistive technology is a little bit wonky on first read, and that's just for no real reason than sort of some of the complexity of some of the things that are discussed. But so it's broken down sort of, and there's a fair amount of discussion about personal emergency response systems and medication reminder systems early on in the definition. And yes, those are certainly forms of assistive technology, but sort of what we are most interested in here at Missouri Assistive Technology are going to be those other forms of assistive technology that individuals can access through waivers. And these are defined essentially as items that enable people to be less dependent upon direct human assistance and include, but are not limited to, and I put in parentheses, there's a lengthy list of scenarios there. So it's pretty inclusive, pretty expansive in terms of the type of assistive technology that individuals might be able to access through a waiver in the state of Missouri. And then there's a cost limitation, which is $9,000 per year per individual. So that's kind of the nuts and bolts of how the waivers are set up in the state. And so how the process in Missouri works is, and we don't, as the Tech Act program, have anything to do with this part of it, but there is a process that begins with a targeted case manager submitting an AT referral form, and then that's reviewed by a utilization review committee before actually being approved. And so it's a fairly straightforward process and accessed, as I said earlier, by a number of individuals. So if we move on to the next slide, sort of talk a little about how we are involved as a state Tech Act program. And I referred earlier to the fact that it's kind of an a la carte approach. We obviously have a lot of totally dedicated and very competent individuals within the Department of Mental Health in the state that do the yeoman's work of everything related to the waivers. And occasionally we try to be useful wherever we can. And way back when Missouri was initially applying for its waivers, and we provided some technical assistance on assistive technology and sort of helped craft some of that language. And then since then, some of the ways that we participated is sort of on the consumer side of the equation, where perhaps a case manager or a family or some other individual who's exploring assistive technology, they want to consider getting it through a waiver. They may reach out to us to provide guidance on device selection, and then subsequently borrow devices perhaps out of our short-term loan program to make sure that it is the most appropriate device before they go through the process of submitting for approval through the waiver process in the state. We also occasionally function as a conduit for purchase. There are some items that people are requesting through the waivers that are a little more difficult to access than others. And since we have a pretty extensive network of vendors that we work with, we will provide estimates, and then if they're approved, go out and purchase devices to provide to individuals that are trying to get particular forms of assistive technology through the waiver. So examples of some of the things that we are providing when we do help sort of function as the conduit for purchase, a number of iPads that have various types of augmentative communication apps on them. As an example, we've done some purchasing of adapted recreational, like a tricycle, I believe, recently here, not too long ago. And then things like the Orcam glasses for somebody who had a vision impairment. So some of those sort of more niche areas of assistive technology that we can sort of speed the process up a little bit by accessing our network of vendors to be able to function as a source for somebody to purchase it through their waiver dollars. Then if we move to the next slide here, which is some of the stuff that's currently underway. Missouri in 2019 announced that it was going to be a tech first state, and it was actually announced on Valentine's Day in 2019. And I think that was appropriate to be announced on Valentine's Day, but it's a full out commitment to the idea of putting an emphasis on technology. And we were fortunate enough to be able to participate in the official launch and be part of the ceremony that day, and had a opportunity to speak a little about what we think will be the impact of assistive technology. And then through our Department of Mental Health, they've been to sort of increase understanding and make connections with the community. They sponsored a series of regional tech fests throughout the state of Missouri in 2019 and 2020, and we were actively participated in those. And those were a wonderful set of events because they brought together organizations like us, plus a number of vendors and some agency representatives with local communities to sort of, again, start to get people to understand and build capacity about what these services are and what assistive technology is there, and expand horizons and get more and more interest. And it's always best, I think, to take things directly to people than it is to send stuff out and hope that they read it. So there were hundreds of individuals that participated in these regional tech fests, and I know I had numerous fantastic conversations that were valuable for helping to educate and make people more knowledgeable about what some of their options are. And then forthcoming in February of 2022, the state is holding its first technology summit, which is being spearheaded again by our Department of Mental Health, but we are honored to be a supporter of that activity and also be participating in it as well. And one of the things that I think has been really successful in Missouri is that, there's just good relationships that were laid years ago, where everybody can be supportive and sort of be on the same page about the benefit of the activities that are going on and the services that are available and that are increasingly expanding as time goes on for residents of the state. And then if we move on to the next slide here, this said, and I put this slide in here with a little bit of hesitation because I have not been able to verify this for sure, but I had seen a report here about a week ago that spoke to some of the assistive technology related things that Missouri is potentially doing, if not doing, as a result of the rescue plan dollars. And that these included expanding use of technology and telehealth, testing the impact of assistive technologies on the need for in-person supports, and then potentially providing smartphones, computers, and/or internet activation fees to address functional needs, promote independence, and/or support community integration. All these are wonderful, and certainly look forward to seeing how they evolve and how we can participate and be helpful. But in particular, that last one, I think could be really valuable in Missouri, because if we learned anything during the pandemic, it's that while technology was very useful for bridging social isolation and other issues people were encountering, we found out just how many people with disabilities are have a much larger gap in the digital divide than others because they don't have the devices and or the ability to purchase some of the things that are critical to being attached in a computer age. So those are just some of the things that are going on in Missouri and how we have interfaced with our efforts, waiver efforts in the state over the years. And I know we have folks from all over the United States. And if you are not familiar with your Technology Act program, I'm sure that other states have wonderful things going on and relationships. And hopefully you will become more familiar with your Tech Act program and what they might be doing or how they can benefit waiver activities in your state. So I'll turn it back over to you, Marty.
Great. Thank you so much, David. And one of the things you mentioned was Missouri's involvement with our Technology First initiative. And I want to go ahead and turn it over to Britta Huff to talk in a little bit of detail about the Technology First movement and activities in Ohio.
Hello, good afternoon. Thank you, Marty. Again, I'm Britta Huff. I work for the Ohio Department of Developmental Disabilities. My role is with the Division of Policy and Strategic Direction, and I'm a Community Life Engagement Project Manager. And so our team is a regional group of project managers that our primary focus is really all around ensuring that people that are eligible for services through our Ohio's developmental disability system have increased opportunities to work and live and thrive in their communities. And we do that through state-of-the-art planning, innovative technology, and supports that focus really on their interests and their skills and their talents. And so we are an expansion. We started as an expansion of Employment First and our initiatives around Employment First. And now we have expanded to also cover and incorporate technology first within all of our work. We in Ohio have had a focus on technology for several years. I will share our timeline in just a few slides, but really since 2011, we've been focusing on how to increase the use of supportive technology within the lives of the people that we support. And we're one of the first states in the nation to get approval to add technology to our home and community-based waivers. And we are also a technology first state through an executive order that was signed in 2018. So I'm just going to talk a little bit today about just our priorities, our focuses. I'll show you kind of our evolution of tech first since we started our efforts, and some of our priorities in our current budget and in our current strategic plan. You can move on to the next slide. So within all of our efforts, our priorities in Ohio are around ensuring that technology is explored to increase the safety, the independence, and control of individuals receiving services. We are looking at and constantly exploring how to use technology as a solution to meet a need, not just for individuals served within their lives, but also supporting the work of our direct support professionals, our providers, and our families. And also that technology is explored and enhanced across the lifespan. So starting at an early age through school-based transition into adulthood and aging. So that's just kind of an overview of where a lot of our efforts come from and what they focus on to increase. We can go to the next slide. So again, we are a tech first state under an initiative, an executive order. We talk a lot about what that means, and that it really is that technology is that first option for individuals. It does not mean that technology is the only option or that everybody needs to have technology included within their services or within their lives. And so under our Tech First initiative, our state agency works with our local county boards. So in Ohio, we have 88 local county boards that provide eligibility determination as well as case management. And so they administer and authorize services at the local level. So we work with all 88 of our county boards to ensure that technology is considered as part of all service and support plans for people receiving services. And so remote support really needs to be considered as the first option when looking at authorizing services to meet a need before authorizing more of our more intrusive services, such as our homemaker personal care staff. Technology first is, again, not technology only, but it really is aiming to help people learn more about how to use technology, whether that is through our paid services or just through technology that we all use on a day-to-day basis, and just learn and understand how it can help improve their quality of life and how they can experience more independence and personal freedom. We'll go ahead on to the next slide, which is going to show you our timeline. I'm going to walk you through and give you a little bit more detail of what all of these milestones mean. And so in 2011, Ohio became one of the first states in the nation to get approval for adding technology to our home and community-based waivers. At that point, we launched an initial remote monitoring service, as well as a remote monitoring equipment service under one of our waivers, our home and community-based waivers. In 2012, we worked with Ohio's Mental Health and Addiction Services to fund telepsychiatry video conferencing technology for people with developmental disabilities. And those are individuals that have co-occurring mental health diagnoses and lived in remote areas without adequate access to behavioral health care or services. It also, in 2012, we enhanced our waivers by create or adding and including the remote monitoring and remote monitoring equipment services to our other waiver, our self-directed waiver. In 2013, we enhanced those HCBS waiver services a bit more and added it to our final waiver, our final waiver of the 3 HCBS waiver services that we offer. So by 2013, all of our waivers did have the availability of the remote monitoring and the equipment that was needed for that remote monitoring service. In 2017, we added assistive technology as a career planning service to really look at how technology and supportive tech could be utilized in a workplace to support independence and success within that workplace. In 2018, again, is when our governor signed the Technology First executive order. And we were the first state in the country to emphasize expanding access to technology for people with developmental disabilities. So that's really exciting for us and a big part of our journey. Throughout that executive order, we had an Ohio Technology Council that met for about 6 months after that executive order was signed, and they developed an Ohio Technology First Council report. And that council report really gave recommendations for how to continue to enhance the use of supportive tech. We also had Ohio State University, the Neisinger Center. They work very closely around technology in Ohio, and they are our Assistive Technology of Ohio entity. But they published in 2018 a remote supports white paper that really talked about the remote support efforts in Ohio, as well as what that means for people that are served. In 2019, we started to implement the Technology Council report benchmarks. And so this, again, included lots of different recommendations around how to continue to move technology first forward and enhance the use of technology. Assistive technology at that point in 2019 was added as a standalone waiver service. And what that means is that we removed it from our career planning service because that was specifically geared towards employment, and made it its own service that can be accessed and to support any environment, so in homes, in communities, and in workplaces. We also enhanced our remote monitoring service by changing that name to remote support service, and that is what it is today. So we still do have our assistive technology and remote support services available to individuals in all 3 of our waivers. In 2020, we continued to implement the Technology Council report benchmarks. We also did technology roundtable discussions with our stakeholders to kind of check in on the progress of Employment First in Ohio. And so we used that information to continue our work, and brought that to a Technology First task force and advisory committee that was created more recently in 2021. So currently in our fiscal year 22, our current fiscal year, and 20 and our next fiscal year, we received a state budget of $1.6 million towards expanding Technology First in Ohio. We also created the Technology First Advisory Committee, which was a group of stakeholders that pulled together recommendations that is now in the hands of a Technology First task force. So the Tech First Advisory Committee was a group of stakeholders specific to our system, so specific to individuals with developmental disabilities. And our Technology First task force is a group of stakeholders that includes representatives from all of our state agencies. And so expanding the conversation and the efforts beyond our system and into Ohio as a whole through all of our services. So again, just a quick overview of some of the main milestones. Lots of things have happened in between those bigger things that we've seen happen throughout our our efforts in technology first. So I'm going to talk kind of a little bit more about where we are now and where we're going with it. So the next slide, I already shared the information about this. Sorry, sometimes I get a little bit ahead of myself. But really this is showing that budget is, this is new funding for our state, and it's all about strengthening our efforts in the use of innovative tech for individuals with developmental disabilities to be more fully integrated into their communities and live with greater independence. Go ahead on to the next slide. So within our strategic plan, we have lots of priorities and goals that are focused not just on technology, but I'm going to share just a little bit about our priorities and our goals and what's happening right now as we go into and as we are in fiscal year 22 and moving into 23. So goal 1 is about empowering individuals and families to explore technology as an option through person-centered outreach, education, and community-based experiences. So through that, we're continuing self-advocacy, leadership, and peer mentoring opportunities. We have a Ohio Technology Ambassador Program that is a group of individuals with lived experiences that utilize technology in their day-to-day life and again, their efforts all around peer mentoring and sharing their story with self-advocates and families and other stakeholders in our system. So we are expanding that program to include families and direct support professionals within that peer mentoring project. We are incorporating technology components throughout all of our family outreach efforts and elevating the technology conversation. And so we are developing a long-term communication and outreach plan that is geared towards elevating that conversation around technology. Goal 2 is the alignment of state and local policies, procedures, eligibility, enrollment, and planning and services across all of our agencies to increase the use of technology and community employment for people with developmental disabilities. So this is where our Technology First Task Force comes into play. Those recommendations from the advisory committee were more recently finalized and can be found on our website. We are working on creating a technology first rule that will kind of put parameters around what technology first means in Ohio and how we ensure that individuals have and explore that option first. We're also evaluating we have an assessment around on-site on-call or services that are occurring during sleeping hours where staff are on site, not expected to be alert or awake during that time. We're looking at updating our targeted case management rules to include technology. We're creating a technology rapid response team, which is really an avenue for our tech vendors to connect with our case managers to help provide options and opportunities for solutions to meet an individual's needs. And so that response team and the technology that will support that connection is in the works. And we're kind of reviewing our current rules and to evaluate kind of where technology can be emphasized and where it can be enhanced within all of our rules and across all of our services. And always looking to revise and enhance our assistive technology and remote supports rule. Goal number 3 is about developing the level of comfort and skills and knowledge that providers need to increase the use of technology in service delivery and within their business operations. So we are developing and implementing a technology first training for our internal DODD technical assistance staff to ensure that they have the knowledge to share throughout their technical assistance, and not just within my role, but subject matter experts that work with multi-system youth, that work with individuals that are living within our ICF and developmental centers. So ensuring that that's across our system being incorporated in early intervention in all of the areas. We're looking at developing a technology-first toolkit, which will include lots of virtual and in-person training opportunities. We have a lot of online courses that are in the works, and we're looking on getting. We currently have a grant that we are seeking contractors to become tech experts within our system, and what that means is to be available for training, as well as being available for maybe monthly technology first live chats or on-demand access to getting information to the people who need it. We continue statewide technology community of practices with our stakeholders to kind of keep a pulse on what's happening, where are the successes and what barriers we maybe need to address. We have we're continuing our regional technical assistance, and we continue to build provider capacity and recruiting other technology vendors to join our state and to provide services within Ohio. Goal number 4 is all about increasing the use of innovative tech across service delivery and business operations. So we have grants and projects that are in the works around innovative technology solutions. And again, this project is it was pretty wide open. Any ideas and projects that providers or county boards or other stakeholders within our system, tech vendors, to propose their ideas around the use of technology within to enhance service delivery and service operations and business operations. So those grantees will be kicking off these projects for this year. We also had a round of grantees in our previous fiscal year, and all of their project results or their reports and information from last year Innovative Tech Solutions is on our DODD website as well. I can drop those in the chat when I'm done talking. We also have one that's similar to the Innovative Tech Solutions project with a focus geared towards our intermediate care facilities, our ICFs for individuals with developmental disabilities. Again, focusing on how to enhance service delivery and business operations. Goal number 5 is to engage with the business community to increase the use of innovative technology across Ohio. And so again, this is within our technology task force, we include Innovate Ohio and Broadband Ohio. So those are other initiatives that have a focus and a connection to technology. And we have continuously meeting with our tech vendors to get input and just, again, keep a pulse on what's happening and how we continue to move things forward. And our final goal is to establish benchmarks and measure progress and achievement of our technology outcomes. So we have a newer initiative in Ohio called Data Ohio. So it is all of our state agencies kind of being transparent about data and being able to make that data available to the public. And so we do include data around our use of supportive technology services. So the use of our assistive tech and remote support services is what is available through that data collection. We want to continue to improve our data collection and analysis with our fellow health and human service agencies, and using that Innovate Ohio platform that is cross agencies to get a better picture of not just what we're doing within the Ohio Department of Developmental Disabilities and in our county boards, but more globally across agencies. And again, all of this is kind of implemented within our strategic plan with very clear benchmarks and progress updates, and all of which can be found on our website. So again, I'll drop some of the links that I talked about in the chat for you. And the last slide is, I'm not going to show any of the videos, but wanted to make sure that I know the PowerPoint will be going out. Wanted to make sure that you had some examples from Ohio of how technology has impacted the lives of the people that we support, and some of the stories that have come out of that. So that is it for me. I'll pass it back over to Marty, and thank you so much for having me, and glad to be here today. It's very great information.
Thanks so much, Britta. Really appreciate it. I just wanted to just touch on just a few areas. There's a couple questions in the chat, just touching on what we've seen and looking through some of the state spending plans specific to assistive technology. There has, one of them had talked about technology first capacity building, expanding dollar caps on assistive technology, adding different types of assistive technology that's covered in their waivers, increasing investment of AT to use in homes and home modifications, developing and delivering AT assessments. Several states that were involved or had included some type of training, whether it was client or caregivers, case managers, kind of a wide variety of audiences for training. Certainly, I think several of the states have experience when they have added assistive technology to a waiver or a type of assistive technology, then the training aspect has been really important for the case managers as well as for consumer groups to understand that there's a new type of device covered or the new type of assistive technology covered, and then under what circumstances is it covered. So training certainly is, I think, a key part of this HCBS effort. Mitigating social isolation is another one that's still was included in several states' spending plans. Of course, there have been some great programs that state AT programs have been involved with, as far as providing tablets or other devices or training to mitigate social isolation. Certainly Illinois, Connecticut, Iowa, Wyoming, and several other states have instituted programs. Expanding emergency preparedness. Certainly assistive technology fits into emergency preparedness, not only for individuals with disabilities, but certainly for centers where people would go in the event of an emergency. Other areas, just generally improving access to telehealth services. Certainly devices, whether it's tablets or other devices, are included in that. Access to additional equipment that promotes independence. Somebody had asked in the Q&A about hearing aids, and of course hearing aids are a type of assistive technology, and hearing is a huge issue in social isolation. If somebody has issues with not being able to hear, whether it's on their telephone or to their neighbors or to their televisions or radios, then that's a huge issue in social isolation. Targeted educational campaigns or promotion and facilitation of the use of AT. Certainly public awareness to make people more aware of HCBS services and assistive technology services is a biggie. And enhancing no wrong door systems. Obviously, assistive technology needs to be included in those no wrong door systems. And then finally, I'll just, there have been a lot of evolving partnerships, and I think some more, I hope, based on the ARPA plans, based on anything from some of the activities that assistive technology programs are responsible for or implement, from the selection and distribution of devices. Almost all assistive technology programs have device demonstration programs, device loan programs to help people make intelligent, informed choices. Equipment reuse programs for assistive technology that's needed, that somebody can't get through another source or the wait is too long through another source. Providing alternative financing or funding programs in some cases, certainly the low interest loan programs, and in partnership with other agencies, possible funding programs. Training, of course, and assistive technology awareness. So those are absolutely areas where there could be some partnerships between assistive technology programs and other entities. Let me just take just a few minutes on questions. Somebody asked how much support from HCBS waivers could be extracted for the acquisition of smart home technology. Certainly, there are several states that have put smart home technology into their plans. Assistive technology certainly is a component of smart home technology, or vice versa. And another question is, are most states prioritizing AT in their plans? Is the majority of increased funding being spent on workforce development? And I think Damon in his slides pointed out that about 19 states, I think, had assistive technology in some aspect of their plans. So certainly some states are definitely looking at smart home technology. I don't know if there's anything else that you want to add on that, Damon.
Yeah, Marty. So there's a couple of points. I did answer some of these in chat, but for those of you who might be dialing in or not able to look at or see the chat, so we did get that question about are most states prioritizing assistive technology? We did find 19 states. The corollary to that question was, or is most of it being used on workforce development? I would say workforce development, due to the challenges out there with sufficient workforce in home and community-based services, is probably the most common initiative we saw across the spending plans. But that's not to say that there's not also assistive technology included in them. When we added up actually all of the proposed spending in the 51 spending plan submitted to CMS, it was $34 billion. So that is a significant investment when you think about the entire Medicaid home and community-based services program costing, I think it was about $160 billion per year the last time I looked. So we're talking about potentially 20% increase of annual HCBS spending as a result of the state and federal funds invested in these programs. There's going to be a lot of different initiatives out there across the states and across the country. But I just want to highlight that. And then Marty, you also raised the smart home technology question. Again, I did address some of this in the chat box as well, but I did want to note that there are states out there with smart home already in their waivers, generally as a subset of an assistive technology benefit. I threw a link in the chat to an example from North Carolina where they did have it included in one of their waivers. In terms of the amount of support that can be extracted, that would be largely contingent upon the decisions made at the state level around what's included in the waiver and any limitations on the cost. A lot of times we'll see an overall cap on assistive technology spending for a waiver participant. So again, if smart homes were a subset of AT, they would also be subject to that limit. Marty, did you want me to address some of the other questions we got that I answered in chat as well, just so that those who can't see the chat?
Yeah, sure.
Absolutely. One of the other questions we got was whether territories can apply for home and community-based services waivers. The answer there is complicated because territorial Medicaid is actually very different in statute than Medicaid in the states and the District of Columbia. We don't see a lot of spending on HCBS in the territories. Territories actually have an aggregate cap on how much federal funding they can draw down each year, whereas state programs are unlimited. For every dollar the state has, they can draw down associated money from the federal government. So you do see this, tend to see much more robust long-term services and supports in state programs. I think particularly because they're very expensive services. So when you have an aggregate cap on territories, it's hard for them to get more expansive long-term services and supports in their programs. Then we also had a question submitted asking about my cost neutrality comments. They asked, must the 1915C waivers be cost neutral for the entire program or for each individual person? Federally, they must be cost neutral for the entire program in aggregate. However, there is an option, but not a requirement for there also to be cost neutrality at an individual level. And if a participant would exceed the cost of serving them in an institution, again, at an option, the state can say that that person is not eligible for the waiver. I would say that's not terribly common. Much more common to see aggregate cost neutrality as opposed to person by person cost neutrality. And then we also got a question that just came in that said, what was the link to state spending plans? And I can't read it out loud, so I will put it in chat. And I also note that it is included in my PowerPoint when that gets sent out.
Damon, let me ask you one question. I know that there are still, at this point in the state spending plans, to what extent are states still working with those? I know that there's still some, for instance, some assistive technology programs that are talking with their states about adding some assistive technology, or they've been contacted by their state Medicaid agency to get some input. So just in the process, I mean, how active is it still?
Again, I think that it really depends at a state level. States, I mean, this funding was passed earlier this year. I want to say March, I don't remember the exact date, maybe April. And CMS gave guidance to states in May on what they expected of them and how they could use the funding. And then they had until July, essentially, to submit these spending plans. So a lot of them are pretty high level, and states are continuing to work to build out the exact activities and talk about talk with their communities, their provider communities, their participants, other state agencies and programs about what the opportunities are to invest this funding. Like I mentioned earlier, CMS is requiring quarterly updates to the plans. And at least when I work with states on these ARPA spending plans, I'm really encouraging them to think of them as iterative submissions. So the quarterly updates aren't just reporting on what you've done and what you've spent from the initial plan, but they're updating your initiatives, maybe adding more detail, maybe making changes based upon what's worked, what hasn't worked, what new opportunities you've learned about in the interim period, just due to the very quick turnaround for those initial plans. So I would say in general, when states have committed funding publicly, it's going to be hard for them to draw it back per se, but you may have opportunities to inject assistive technology into some of the other goals that were proposed at a broad level, as well as to work with the states to augment the assistive technology components that were included in their initial plan in those states that did include it. And then lastly, the dollar amount that states are going to pull down from CMS is not necessarily set in stone. It's going to be contingent a little bit on how much they spend on home and community-based services during the period that they're eligible for that increased match. So to the extent that the state has more money available to spend than they initially projected, there could be opportunity for additional investments there as well. I think that that's the long answer. The short answer is I would encourage you guys to be working with and dialoguing with your Medicaid agencies as much as you possibly can on these types of initiatives, because there's a lot of opportunity. And I know that the states are looking for help and ideas from their partners and colleagues.
Great, thank you so much, Damon. I want to thank again each of our presenters. Really appreciate your participation and appreciate everybody who's been involved. Again, we will be sending out a survey, and among that, we would appreciate any input into what your state is doing as far as if you are involved in specifically in any assistive technology initiatives in your state plan or new ones in your home and community-based services, then we would appreciate hearing about that too. So again, want to thank everybody. We appreciate, and again, we will be sending out the slides, and we'll also be sending out a link to the recording within a few days. So go and thank you everybody for being a part of the presentation, and we hope you have a great day.